In this video, I will be utilizing the teach-back method for discharge teaching on managing diabetes. I would first explain to the patient that diabetes is a chronic, a long-lasting health condition that affects how the body turns food, especially sugar, into energy. I would then also describe that insulin is a hormone that is made in the body and it controls the amount of sugar in the blood. And so diabetes can be managed by measuring the amount of sugar in the blood. Since sugar is the body's main energy source, a reading of less than 70 would indicate a lower than normal blood sugar. And without proper management and without proper treatment, someone with low blood sugar can pass out. Symptoms include sweating, might feel hungry, tired, irritable, feelings of pins and needles in the hands and feet, slurred speech, might feel anxious, have a rapid heartbeat, and might feel some tingling in the lips. If this occurs, the patient will want to drink a half a cup of any juice or soda. It's important that the patient understands that diet soda does not count here. So apple juice, orange juice, pineapple juice, and then recheck that blood sugar in 15 minutes. I would want the patient to tell me what a low blood sugar is and some symptoms of low blood sugar and what the patient can do if the blood sugar is low. So I would expect the patient to identify low blood sugar as a reading that is less than 70 and the symptoms that are associated with low blood sugar. So those symptoms, I would want the patient to identify 1, 2, or 3 symptoms, so sweating, irritable, anxiety, rapid heartbeat, something like that. And then I would also want the patient to identify an appropriate action to take, like drinking a half cup of juice or regular soda and rechecking their blood sugar within 15 minutes. After the patient demonstrates understanding through the teach-back method here by telling me what the low blood sugar is, some symptoms, and what they can do, I would then proceed to go on to high blood sugar. And high blood sugar occurs when there is a reading of greater than 200. And some symptoms associated with high blood sugar include feeling thirsty, having a headache, trouble concentrating, blurred vision, might pee a lot, and they might feel really tired. So if the blood sugar levels are not managed properly, it can cause a stroke, can lead to heart disease, can lead to numbness in the hands and the feet, blurry vision, that can lead to vision loss, damage to the kidneys, numbness or weakness in the hands or the feet. So utilizing the teach-back method here, I would want the patient to explain back to me in their own words what can happen if blood sugar is not properly managed. And so going back to low blood sugar, I would want the patient to identify that the blood sugar is less than 70, there's a risk that they can pass out. And then I would also want the patient to identify that a high blood sugar can damage the body. And if they can identify at least 1, maybe 2 consequences associated with uncontrolled high sugar levels, associated with the kidneys, eyes, loss of sensation, the heart disease or the stroke, then they have demonstrated back to me that they understand what can happen with both low and with high blood sugar levels. I would then proceed to talk about proper insulin administration, especially with patients who might have newly onset diabetes or managing the proper care through oral diabetics. Through type 2, there's oral medications for type 2 diabetes, and making sure that they understand the importance of following that medication schedule that they might have. So proper insulin administration will be demonstrated to the patient, with newly onset diabetes. Handouts will be used to reinforce the patient teaching. I would instruct the patient to check the blood sugar and follow the instructions based on the type of insulin that is ordered. If there is rapid insulin, the patient will want to have something to eat or drink that has sugar since it starts working within 15 to 30 minutes. Not eating can result in low blood sugar and the risk of passing out, as noted before. The handout would include the different types of insulin, so rapid acting, short acting, intermediate acting, and long acting insulin. And the education will be provided on the peak times as the greatest risk for low blood sugar. Utilizing the teach-back method, I would want the patient to tell me when they have the greatest risk for low blood sugar and what the patient can do to prevent it. So the patient should identify the peak times for the highest risk of low blood sugar, and utilizing the handout will be useful here because the patient may not remember all the specifics if they're using different types of insulin. It can be very complicated and confusing for the patient, so making sure that the process is simplified as much as can be. So the patient should identify peak times for the highest risk of low blood sugar and the need to monitor for symptoms of low blood sugar. And the patient will want to tell me that they are going to eat or drink something with sugar before the onset of the insulin, and making sure that they identify when those peak times will be their greatest risk. I would then proceed to teach the patient how to store, manage, and inject insulin. It is important to give insulin at room temperature and not use expired insulin. And if the insulin is stored in the fridge, the patient should take it out 30 minutes before use. The patient will want to measure their blood sugar and identify the amount to give themselves based on the provider's order. And so to give insulin can be injected in the belly. So I'm going to identify sites where insulin can be given to the patient. Insulin can be injected in the belly, at least 2 inches from the belly button. It can be injected into the back of the upper arms. I would show the patient that here is the back of the upper arm, the belly. And then the back, or the front of the thighs, so front of the thighs, or the upper buttocks, so on their backside here. I would also tell the patient that they want to rotate the site daily. So if you're on the stomach, you want to make sure that you're rotating it around the stomach. And make sure that when they administer it, that they're pinching up some skin. So if in the back of the arms, we want to pinch up some skin and quickly insert the needle at a 90-degree angle. Keep the skin pinched, push the plunger all the way, and hold the needle in place for 5 seconds. The patient will then retract the needle and discard the needle appropriately into a sharps container or a bin that is designated for that type of injection. You want to make sure that they store the pen as indicated in the instructions when it is received. So utilizing the teach-back method, I would want the patient to explain back to me where they can give the insulin and show me how they would give it to themselves. Utilizing the teach-back method, the patient will identify the proper sites for insulin, including the stomach, the back of the arms, thighs, and the buttocks. The patient will tell me they will rotate their injection sites, pinch the skin, and hold the needle at the proper angle, keep the skin pinched, and inject the amount of insulin that is needed. I would then proceed to ask the patient if they had any questions, and I would make sure to clarify any statements that I made that may be unclear. I would also rephrase using the teach-back method any of these questions in the teach-back that may be confusing or the patient does not seem to understand. And this is how I would utilize the teach-back method for discharge teaching on managing diabetes in patients.